Afternoon, everybody. Welcome to the Multicultural Media Online Conference, a platform brought to you by the New South Wales Ministry of Health and the New South Wales Multicultural Health Communication Service. And this is a platform for multicultural media to learn more about the latest health updates and prevention strategies and resources that exist for our culturally and linguistically diverse communities. My name is Dr. Marianne Gale, and I'm the Director of Population and Community Health Services in Southeastern Sydney Local Health District. And I'm your moderator for this session today, filling in from your usual host, D'Souza Helaratne, the Deputy Director of the New South Wales Multicultural Health Communication Service. Jess is on a well-deserved break, so I'm with you this afternoon. At today's session, our focus is on women's health. Earlier this month, we celebrated Women's Health Week from September the 4th to September the 8th. Women's health spans three life stages, particularly the stages of adolescence, women when they're in reproductive age, and then menopause. And in each of these phases, women can encounter some particular symptoms and might have some varying disease risks over the course of their life. And today we're going to talk about some of the important issues that face women over that life course, particularly around cervical screening and also about menopause. And to help us in that discussion today, I'm pleased to introduce our guests. A regular to this forum, well known to all of you, is Dr. Jan Fizzell, Senior Medical Advisor for New South Wales Health. And she also represents the Office of the Chief Health Officer. So Jan, thanks so much for joining us today.
Afternoon.
I'm also very happy to have with us Dr. Vani Arjunamani, General Practitioner and a full-time clinician for over a decade, who has a passion for supporting women, particularly around chronic disease management and preventive healthcare, which we know is so important. So Dr. Vani, welcome to the forum. Thank you for joining us.
Thank you for having me.
I'd like now to acknowledge the traditional custodians of the land that we're meeting on today. From where we are here, we are on the lands of the Camaragal people of the Eora Nation. I pay my respects to elders past, present and emerging, and Aboriginal colleagues who might be on the line with us today. I also want to acknowledge our elders and leaders from multicultural communities here in New South Wales and pay my respects as well to all of you. So as usual in these sessions, we're going to do our best to answer any questions that you may have. Please ask questions and make comments that you would like to in the chat, and please share your thoughts with us during the session. We'd really love to hear that as we go through the next half hour. Our staff from the New South Wales Multicultural Health Communication Service will be adding links in the chat for resources and information that are available in multiple languages, and also media releases and other health information and health initiatives that you can download from New South Wales Health, from the Multicultural Health Communication Service website, and from the New South Wales Government website. So lots of information that will be posted in the chat as usual. Please look to that chat for those resources. Okay, now before we move on to have our specific focus on women's health today, I'd like to first ask Jan to give us an overview of an important issue happening in the community at the moment, which is around whooping cough. So we just have an important update from Jan around whooping cough, and then we'll come back to have our focus on women's health. So thanks, Jan.
Thanks, Marianne. Whooping cough is on the rise in New South Wales, and it's really important that people are aware of how to protect themselves and who most needs protection from whooping cough. So New South Wales Health is urging pregnant women, parents and carers of babies, grandparents, and other people who are in close contact with babies. So if you spend a lot of time babysitting your niece or nephew who's quite young, it's really important that you're vaccinated to help protect babies from severe disease. The New South Wales Health latest respiratory surveillance report shows notifications of whooping cough are at their highest level since 2016. So a lot of people will be meeting, especially small children, this disease for the first time. And we've had over 12,000 cases reported from January to September 2024. Whooping cough, also known as pertussis, is a serious respiratory infection. It's caused by the bacteria Bordetella pertussis, and the disease spreads easily from person to person through droplets made when we talk, speak, sneeze, or cough. And premature infants and babies less than 6 months old are at the highest risk of getting very ill, and it can be life-threatening. Vaccination in pregnancy is very important to help protect newborn babies who are most at risk of serious illness from whooping cough. And again, we are asking people, if you've got kids at school or family members who've got a cough and it's been chronic or it's new, to make sure that you don't spread those germs around. Do try and stay home, and please don't go and visit new babies to the household. Really, really important.
Great. Thanks so much, Jan. So some important messages for everybody to note around whooping cough, and some things that we can all bear in mind and try to put in action to try and reduce the transmission and illness in the community from whooping cough. So we're now going to come to have a focus on cervical cancer as one of the key things we want to talk about today, and specifically around screening for cervical cancer. We know that cervical cancer is one of the most preventable cancers. More than 70% of cases occurring in women and people who have a cervix are in people who have never been screened or who are not up to date with their screening. So we know that screening is really important if we want to pick up and reduce cases of cervical cancer. The cervical cancer screening test is the best way to prevent cervical cancer. It is a quick and simple procedure that looks for a viral infection called human papillomavirus, also known as HPV. So in a moment, we're going to be playing a short video about the cervical screening test, and also a self-collection option, which is relatively new, introduced in 2007. And that's an important new option for many women who may not be comfortable with the conventional procedure. So it provides another way where cervical screening can still occur and detect early symptoms. So now we're going to take a few minutes to watch the video and learn more about how we can prevent illness related to cervical cancer.
We have been encouraging all women aged 25 to 74 years who have ever been sexually active, even with just one partner or only with the same sex partner, to go for a cervical screening test every 5 years. With our work in community, we know there can be several barriers for women to go for cervical screening. This can include new migrants not making time for their own health when they are trying to settle into a new country, or older women who are not sexually active thinking they do not need a cervical screening test. That's why it is important that we provide culturally appropriate education to help our community understand the importance of cervical screening and how they can participate, as well as promoting the recent policy change allowing all women the option to choose self-collection. All women now have two options for having a cervical screening test: to have a health professional collect their sample, to collect their own vaginal sample, known as self-collection, in private, both done at a healthcare clinic. Both screening options are equally safe, effective, and accurate. This is an exciting update because it empowers women in our community with choice in how they participate in cervical screening.
Okay, great. I think that's a fabulous video. Now that we've seen that video, Jan, I'd love to hear your thoughts. How do you think we can better promote women's health, specifically around preventing cervical cancer?
Look, I think it depends on people's ages, and different people have different ages and different perceptions about what they need to do. I think the first message is to young women and young people with the cervix who may have been vaccinated at school and may think, well, I don't need to worry about getting screened. I've been vaccinated. And while the vaccine is really, really good, some people will still develop HPV infection despite being vaccinated because there's a number of different strains of HPV. The vaccine covers a number of them, doesn't cover all of them. So it's really important that even if you've been vaccinated, so the message to young women is even if you've been vaccinated, get screened. And then again, there's that message to older people in the community who may not have been sexually active for quite some time, may have only ever had one sexual partner, may have had one sexual partner a long time ago and think, well, that's not going to happen to me. I'm not sexually active. And the answer is you still need to go for screening. And it's easy and it's convenient and it's very private. So people who've got horrible memories of cold speculums and I know that GPs are very, very careful and very, very kind, and these things never happen. But every so often there is somebody who's had an unfortunate experience or has had problems, with their own sexual history where they're really reluctant to be around other people. And self-collection is a really good alternative for those people. So there are good reasons still to see your GP, and you may still need an examination, but it's a really exciting option for a lot of women.
Thanks so much, Jan. Vani, I'm interested in your thoughts and reflections. Many people in the community might be familiar. For a long time, we talked about, having the PAP test and having the PAP test every 2 years. That's changed a bit. Can you tell us, what's changed and what's important for women to understand now?
Sure. So since 2017, it became the cervical screening test. It's a more accurate test. And if the test is normal, we need to do it every 5 years instead of 2 years. So it's more convenient now. And it's a quick and simple procedure that we do all the time as GPs. So it looks for, like you said, the actual virus, human papilloma virus, and that is the cause of almost all causes of cervical cancer.
Mm-hmm. Great. Thank you, Vani. Another common question, which Jan touched on earlier, is that I'm sure you hear this all the time, perhaps in women coming to your clinic, is that we've been vaccinated against HPV. So why do we still need cervical screening? So what would you normally tell your patients, Vani, when they tell you that?
Sure. And like Jan alluded, that it doesn't cover all strains. So it only covers about 9 strains. So at the moment when we do test, we're seeing a rise in not 16, not 18 type of HPV virus. So I tell that to the patient. So yes, there are some strains that we can't test for, that we can't vaccinate against. So it's important that you do need to have the test. But interestingly, the vaccine is an Australian invention by our very own Ian Fraser, who was the Australian of the Year in 2007. So I'm hoping that we will get a Nobel Prize out of this.
I think certainly, the introduction of the HPV vaccination is a wonderful thing for women's health, in Australia and globally. Correct. So we're extremely lucky. It's been a big advance in recent years.
And it's also not just for girls. All children in year 7 get the HPV vaccine as per the New South Wales schedule.
That's right. Thanks, Vani. We talked a little bit earlier, and as well as what we saw in the video around self-collection. Sure. Can you tell us a little bit more about that, in your practice when you see women?
Sure.
How do you manage discussions around self-collection?
So it's my practice to always routinely remind women to do their cervical screening test, and especially the women who are a bit reluctant, like Jan, you mentioned, who have not had sexual intercourse for a while or do not have a partner. I mean, I think there will be a good population to, here you go, you could do it yourself right now. And that's all done. So it's a very convenient option there. And of course, also for patients who have a traumatic history, who've never been tested, this is a good opportunity as well. And equally, there are people who want the GP to do it. So they have the option. Having an option gives power to patients.
Yeah, I think that's great. And there's also options in terms of locations where people can get screening. Sure. So obviously, for the majority of people, talking to their GP about it is the best the best thing, and we want our people to see a GP for many other reasons.
Thank you.
But where are some other options where women can go for cervical screening?
Sure. There's Family Planning New South Wales. You can do your cervical screening there. Many GP practices also have nurse practitioners, who are also available in women's health centres, as well as children's health centres. So, and also sexual health clinics. So there are a few places they can go to.
So quite a lot of options.
Correct.
In terms of where to test and also how to test.
Correct.
Great. Vani, I'll stay with you for another question, particularly for women from multicultural backgrounds where sometimes there can be language barriers. Do you have any tips or suggestions on translated resources that can help women who may not have English as a first language understand what they need to do and that support them to stay on track with these important screening measures?
So like many migrant communities do talk to each other, and they probably can refer to a doctor who speaks their language. So like myself and many cohort, they speak a second language and it's helpful. But if you are a GP or a health professional who doesn't have that access, there is the translation interpretation service, which is 13 14 50. Yeah. So which the clinician can book for the patient, or the patient themselves can book for themselves. So it's a very useful resource. And I think a lot of resources are available through the New South Wales Developed Cancer Institute. I think they have over 50 languages. I think they're sitting over there, aren't they? So there we go. Full, exactly. So to engage the population is very interesting because their priority is not health. Their priority is to set up their kids. So I find this a big challenge, trying to empower women to put themselves first. And this is the rationale I use. If you don't look after yourself, you can't look after anyone else.
Yeah. I think that's so important. And we know that actually to do this, sometimes we build these things up in our head to be bigger than what they are. It's actually quite easy. It's very quick. It doesn't take much time. And as you say, it's really important for women to be there. They have to take care of themselves if they're to look after their families and for their kids. So really quite a quick and easy thing to do. Jan, the cervical screening test sounds like, clearly it's an excellent health initiative. Is it available for free? Do you want to speak to that a little bit? And are there we're talking about cervical cancer screening, but are there other important sort of cancer screening things that people need to be aware of? And, cost is an issue for all of us, and it's always front of mind. Are these tests free?
Yeah, and so there's a Medicare rebate for cervical screening. So you talk to your GP about that. Some doctors will provide the cervical screening test for free. Others, you'll just pay for your appointment like you normally would. With most of the cancer screening tests, there are 3 national programs. One is for breast cancer screening, which you will have seen through Breast Screen New South Wales. The other one is the really important bowel cancer screening program, and that's something that can arrive in the mail. And that's why it's really important that if you can, you keep your address updated with Medicare, because that means that you get these reminders for these national screening programs. And sometimes it can be quite daunting when you turn a certain age and all sorts of things start arriving in your mailbox, say you've got older. Yeah. But it means that it's time to really take stock of your health, and talking to your GP and getting them to help you take stock of your health is a really good thing. But of course, it's not just about screening, it's also about what we can do to prevent cancer generally. And there are things like not smoking, because it doesn't just, people often associate smoking just with lung cancer, but it can increase your risk of a number of cancers, including cervical cancer. Eating healthily as best you can with plenty of vegetables and fruits, regularly exercising, having those tests every 5 years, but also keeping up to date with other cancer screening. And if you're interested to see, is this screening test right for me? If you've got questions about it, your GP is an excellent resource to help you with those questions, because people often do have questions, or they've heard that somebody else has had this experience. It's really good for myth busting to talk to your GP about what those tests actually mean. And your GP can make sure that you know what services are available locally. encouraging immunisation against HPV and encouraging both boys and girls to get immunised. It also can help prevent cancers in boys as well as in girls. So it's not just important for vaccinating girls to prevent cervical cancer, it can also prevent cancers in boys as well. So it's a really important initiative, and it's free, and it happens through schools. So really encourage people to take advantage of that opportunity.
I'll add to that. If they do miss at school, they can always come to the GP and catch up that way too.
Absolutely. And even some pharmacists will help catch up with the HPV.
Great. All right. So lots of important advice and messages there around cervical screening. So really important women's health subject. We're going to shift slightly now to talk about another very important aspect of women's health that occurs later on in women's life, and that is menopause. Vani, next month is World Menopause Day on the 18th of October. So let's, use that opportunity to have a bit of a discussion around menopause. And sometimes it is a bit of a confusing term, or people have a different understanding around what menopause actually is. Could you explain to us what is menopause?
Yeah, I say this to my patient all the time, and they ask me, am I going through a menopause? So it's very simple. There's no need for any blood test. All you need to ask yourself is, have I had periods in the last 12 months? If the answer is no, then you are in menopause. But if you are saying, well, my periods are a bit erratic here and there, then that's perimenopause. So that's the stage before you get to menopause. So it's actually the word menstrual pause, so menopause. So, and the age ranges, like you ask my patients, when did your mother have a menopause? It's a guideline. They say roughly around 45 to 55, but some women have early menopause, that's before 45, and other women have premature menopause, that's before 40. So it's good to know what these signs and symptoms are, and we can manage that. Usually people are aware of the more common hot flushes, irritability, and night sweats, but they don't often make the connection that heavy bleeding and low iron that comes as a consequence of it is also related to perimenopause. So, and addressing the perimenopause or menopause well means we can help you overall.
Okay, great. That's really helpful. We know that many health issues for women, like menopause, can be difficult for some women to talk about. Sometimes there's stigma associated around these topics in some communities. And that's partly why, we're having the conversation today, because it's a natural part of being human, of being a woman, and it's important that we talk about these things. Are there resources available to help people better understand menopause, understanding what's happening to their bodies, and resources to help them manage some of the symptoms they might be experiencing?
Sure. So the main thing is they can always approach a GP and find out what they're experiencing. Is it menopause or perimenopause? But also for themselves, internet is a vast resource, but it's very important to find the right resource. And so the New South Wales government has, as part of the World Menopause Day, launched the menopause awareness campaign. So as part of that, there is a perimenopause and menopause toolkit. And in that, it's free. There's a checklist. So I would encourage anyone who's in the audience, or if they are suspecting they have menopause or perimenopause symptoms, to do that checklist, fill it out, and take it to a healthcare provider and have that conversation. Unfortunately, particularly in migrant communities, there is this expectation. This is just normal part of life. We just need to get on with it. Agreed, we need to get on with it. But like with anyone, we do need to get help with that. There's nothing wrong with seeking help to get on better with it. Let's just put it that way.
Great. Well, thank you very much, Vani. I think some really important and valuable resources there to help people, understand what's happening to their bodies at different stages in life, and get access to information for their own awareness, and to support them through some years, which can be difficult for some people, and everyone experiences it a little bit differently. All right. Well, we're almost coming to the end of our time today, and I'd like to take this opportunity to remind you, if anyone does have a question or a comment that you'd like to make, please do pop it in the chat. We will try and take your questions on any of the things that you've heard today, or if you have another question related to women's health, we'd be happy to try and answer that as well. So I'm looking out for any questions and comments coming in the chat, and we are happy to try and take those questions. All right, so we don't have any questions that have come through so far. So I'll put out a final call for any questions. Otherwise, we will move to wrap up today's session. Is there anything, Jan or Vani, that you'd like to add on top of the things that we've discussed already today?
I think it's important to add with the self-collect test, even if it comes back abnormal, you do need to see your healthcare provider to do the proper cervical screening test. So it's not just set and forget. So there's further follow-up is necessary.
Thanks, Vani. Jan, anything that you'd like to add or emphasize?
Oh, just to say that I think it really is important that women do take time for their health, because I think that is the key message, that if you don't take time, and it can be really, really hard. I mean, I speak for myself, knowing how hard it is for me to take time to go and see my GP, and I get in trouble regularly when I do see her because I haven't seen her often enough. But how important it is, because there are things that you don't know are going on that your GP can help you find out. And especially as you do get a bit older, it is really important that things that you think, oh, I'm just coping with, your GP can make a huge difference to helping you understand what's happening with your body and really helping you understand what's available to help manage some of those symptoms if they really are disrupting your life, because there are things that can be done to help with menopause and perimenopause symptoms, so that your family does not have to quake in fear if you are having one of those irritable moments. You don't have to be sleepless. You don't have to be sweating through the night and all of those things. There are things that your GP can talk to you about.
Agreed. And I would like to say, put the call out to the rest of the world. I mean, they need to step up to help these women who are going through menopause, because they are looking after teenage kids, elderly parents, whilst juggling family and the house. So I'm sure you've seen pictures of a woman with like 8 hands trying to do all this stuff, and that particular time frame does prove a challenge. So everyone, if you can help your mum, aunt, that'll be great.
Exactly. I think that's some great practical advice, Vani. Now, in our last few minutes, Vani, I know that today we focused on the topics of cervical screening and menopause in relation to women's health, but I know a particular passion of yours is around chronic disease management. And I just wondered, I know we've only got a few minutes and that's a big topic in itself, but are there other sort of just a few key messages that you would like to also share with women around taking care of other really important aspects of their health?
I usually use when women comes with their menopausal symptoms, this is a perfect time to do their heart health check, which particularly in the migrant populations in the subcontinent and Southeast Asian, the risk of heart disease is quite high, men and women, especially in the 40s. So I usually use that, and I kind of preface it as like, look, the treatment for menopause requires these as prerequisites. They don't really, but it's a way to get them everyone engaged, caring for their health, because there are many healthcare practitioners also, when they think of women's health, they just think about the cervix. It's beyond that. There is a heart. All women have heart, and they do need to be checked. So this is a perfect opportunity to do that. And as unfortunately in that subcontinental and the Southeast Asian population, diabetes, and they happen earlier, gestational diabetes. So it's very important to check all their risk factors. And I think, thankfully, majority of GPs are women, and they are very equipped to deal with all of them.
Thanks, Vani. I think that's a great message. So we've heard today around women's health, some specific and important messages around cervical screening, about menopause, but also really important that across the lifespan, it's really important that women take time for their own health, to develop a relationship and see their own GP regularly, because there's a number of things that occur across a woman's life where it's important to have those regular health checks to make sure that they are healthy and well, not only for their own benefit, but so that they can, do the important caring roles that women often take in our society, or continue a career or whatever it is that is their ambition. But being healthy is extremely important. So go and see your GP. and have that conversation with your GP around your health. So thank you so much, Jan and Vani, for being here with us today. And I invite you all online to please tune in the next fortnight for the next online media conference. And do let us know if there's any particular topics that you would like us to feature in these online sessions that are important for you or for your communities. As usual, a recording of this will be available on the New South Wales Multicultural Health Communication Service website and social channels. And we'll also send you an email shortly with the recording and the resources that you can use. So thank you very much for joining us today. Please take care and stay safe. Thank you.